Я нещодавно опрацювала репортаж про небезпечний стан СНІДу в Україні, який тепер вам покажемо. We know a lot more about HIV/AIDS today than we did in the early 80s. The first case was reported back in 1981. Since then, it's no longer called the gay plague. It's no longer a death sentence, but the numbers keep growing. Almost 33 million people around the world are infected with HIV. Now, most of those numbers are in Africa, but there's a different kind of statistic that's just as alarming in another part of the world, Eastern Europe and Central Asia. That region right now is seeing the fastest growing epidemic. The last AIDS conference was held in Vienna, Austria, because the city is seen as a crossroads between the West and the East. It helped bring attention to HIV growth in Eastern Europe, where there is an alarming trend.
Outside of sub-Saharan Africa, injection drug use accounts for 1 in 3 new HIV cases. So that's note to self. What's going on there? If you look at Eastern Europe, one particular region, where 80% of HIV cases are among injection drug users.
One of the big talking points at the AIDS conference was the Vienna Declaration against the war on drugs, against criminalizing drug use. It says that evidence shows law enforcement has failed to prevent the availability of illegal drugs. And to put a stop to the growing HIV infections among drug users, the declaration calls on governments to decriminalize drug users, scale up evidence-based drug dependence strategies. Strategies like harm reduction, which includes handing out clean syringes to drug users so they don't infect each other.
There's plenty of evidence that shows that it is helpful, that it does reduce harm, and it does save lives. And that's what harm reduction is about, is saving lives. It's not about encouraging drugs, because, I had to think long and hard about this, because a lot of people are like, well, aren't you encouraging drugs? And I'm like, no, harm reduction is not about encouraging drugs, and it's certainly not necessarily about treating addiction. And I know that's a little shocking, but it's really about making sure that people reduce the harms that could lead to death.
More than 18,000 people have signed the Vienna Declaration, including the former presidents of Brazil and Colombia, and also the cities of Vancouver and Toronto. But something very disappointing to the International AIDS Society is that the Canadian federal government has refused to back it.
They're really having a Russian-style policy when it comes to drug addiction. They are basically saying either you're clean or you are not in our books. They have very low tolerance for any approach that would be directed at working with the drug user to mitigate the harms associated with drug use. Until such time that the individual may be willing and able, psychologically and physically and socially and so many other ways, to embrace a different program.
The Ukrainian government has also not supported the Vienna Declaration. Meanwhile, there are about 300,000 injecting drug users in the country, and up to 70% of them are HIV positive. How worried are you about the situation of, the spread of HIV in Eastern Europe right now?
Well, I think that this is a very significant concern, particularly if you consider the degree of neglect that HIV has suffered in Eastern Europe, in many Eastern Europe countries over the last decade. The failure of Russia in particular to embrace evidence-based public health policy to address the HIV epidemic is a very serious concern, and unfortunately we don't see that changing anytime soon.
Leah Utyasheva, a consultant who has done a lot of work on HIV prevention in Eastern Europe, says the Ukrainian government has at least legalized opioid substitution therapy. A drug like heroin is replaced by a longer-lasting, less addictive drug. It improves drug users' health, and because it's done under supervision, it reduces the risk of HIV infection.
However, in some parts of Eastern Europe, this is still illegal, notably in Russia. Russia is very famous for being criticized for banning substitution therapy. As I said, Ukraine has allowed it and legalized it. So now both buprenorphine and methadone are legal, and there are programs run, but they're mostly funded by international donors, especially by the Global Fund to fight AIDS, tuberculosis, and malaria. and the government of Ukraine is not funding it. And there were recently some reports of harassment and prosecution of clients and doctors who participate in substitution therapy programs.
It's a step in the right direction, but do you think it's enough?
It is. It's definitely a step in the right direction, but it is not enough. The government needs to take leadership in promoting reform of laws and policies that would eliminate or reduce stigma and discrimination against those vulnerable groups. Because, as I said, vulnerable groups are the hardest hit by HIV epidemic, and they're mostly vulnerable to the HIV epidemic.
There is still a lot of discrimination and stigma in Ukraine against those who are HIV positive, and that leads many Ukrainians to fear being tested or telling people that they are positive.
The frequent violations of confidentiality. So if I suspect that I might be HIV positive, I have children, I have my partner, and I know that if my HIV status will be known in my community, I will be discriminated, I will be stigmatized. My children might not be able to go to school or go to kindergarten because sometimes childcare facilities ask for a certificate of health, including HIV status.
There is a long way to go to turn things around in Ukraine and Eastern Europe, and AIDS groups are pushing to convince governments to change their approach.
There is a unique opportunity for us to avert a major crisis in Eastern Europe, and we shouldn't be missing that opportunity. Today we can, with effective interventions, things that we know work, better policies for drug users, better harm reduction, better methadone maintenance, better low threshold initiatives to engage them in appropriate access to care, and so on and so forth. If we implement all of that, the Eastern European epidemic could actually bend the curve very quickly, and that would be very satisfactory for all of us at this time.
Various AIDS organizations say that an efficient response to the epidemic is going to need a shift from exclusion and blame to inclusion and support. UNICEF, for one, says that the biggest step that needs to be taken in Ukraine right now is that the society, the government, the healthcare system all need to understand and accept that people living with HIV and those most vulnerable to infection, like drug users, kids on the street, sex workers, that they all have the same rights as everyone else.